Hey, what's up everybody? Dr. Mike here, and I'm excited to be teaming up with Kay today to talk about something we often overlook, our feet. Believe it or not, those tootsies can tell us a lot about what's going on inside our bodies. We're going to walk you through 10-foot signs that could mean your health is in trouble. Now, I'm not saying you should diagnose yourself based on this video. That's what we doctors are for. But being aware of these signs can help you catch potential problems early on. Don't forget to like, subscribe, and hit the bell icon for more health tips. Have you ever noticed your feet looking a little puffy, like they're wearing tiny water balloons? Well, that swelling, also known as edema, can sometimes be a sign of heart issues. Your heart works hard to pump blood throughout your body, and if it's not functioning at its best, fluid can build up in your lower extremities, especially your feet and ankles. Now, don't freak out if you've had some temporary swelling after a long day on your feet. That's totally normal. But if you notice persistent swelling that doesn't go away, it's definitely worth getting checked out by a doctor. They can determine the underlying cause and recommend the best course of action. Our feet take a beating every day, so it's no surprise that they might ache from time to time. But when that pain becomes a regular occurrence, it's time to pay attention. Persistent foot pain can be a sign of arthritis, a condition that causes inflammation and stiffness in the joints. There are different types of arthritis, and some can affect the joints in your feet, leading to pain, tenderness, and even difficulty walking. If you're experiencing ongoing foot pain that just won't quit, don't ignore it. Schedule a visit with your doctor to get a proper diagnosis and discuss treatment options. Ever feel like your feet just can't seem to warm up, even when you're bundled up in blankets? Cold feet can be a sign of poor circulation, meaning your blood isn't flowing as efficiently as it should. There are a number of things that can contribute to poor circulation, including peripheral artery disease, PAD, diabetes, and even smoking. If you frequently experience cold feet, especially if it's accompanied by other symptoms like numbness or tingling, it's essential to talk to your doctor. We've all been there. Those sudden, intense cramps in your feet that make you want to scream. While often harmless and temporary, frequent foot cramps can sometimes indicate a nutritional deficiency. Electrolytes like potassium, magnesium, and calcium play a crucial role in muscle function. And when your body is low on these nutrients, you might experience muscle spasms, including those pesky foot cramps. Make sure you're eating a balanced diet rich in fruits, vegetables, and low-fat dairy to ensure you're getting enough of these essential minerals. Our toenails are usually a healthy pink or white color, so when they start to turn yellow, green, or even black, it's a definite cause for concern. Discolored toenails can be a sign of a fungal infection, which thrives in warm, moist environments like sweaty shoes. Fungal nail infections can be pretty stubborn, so it's best to catch them early. If you notice any discoloration, thickening, or crumbling of your toenails, see a doctor or dermatologist for treatment. Numbness or tingling in your feet can feel like pins and needles, or like your foot's fallen asleep and just won't wake up. While this sensation can be temporary, persistent numbness can be a sign of nerve damage, also known as neuropathy. One of the most common causes of neuropathy is diabetes. High blood sugar levels can damage the nerves in your extremities, starting with your feet. If you experience frequent or persistent numbness in your feet, it's crucial to get your blood sugar levels checked. Chapter 7: Foot sores, a warning sign for diabetics. For most people, a minor cut or blister on their foot is no big deal. But for individuals with diabetes, even small foot sores can be dangerous. Diabetes can impair blood circulation and nerve function, making it harder for sores to heal properly. If you have diabetes, it's vital to inspect your feet regularly for any cuts, blisters, or redness. And if you do develop a foot sore, don't try to treat it yourself. Seek medical attention immediately to prevent infection and promote healing. We all experience dry skin from time to time, especially during the colder months. But if you notice persistent dryness and flakiness on your feet, it could be a sign of a thyroid issue. The thyroid gland produces hormones that regulate metabolism, and an underactive thyroid, also known as hypothyroidism, can cause dry skin, brittle nails, and even hair loss. If you're concerned about dry skin on your feet, along with other symptoms like fatigue or weight gain, talk to your doctor about getting your thyroid levels checked. Clubbing of the toes is a condition where the tips of your toes become enlarged and the nails curve downward. While it might not be painful, clubbing can be a sign of an underlying medical condition, including lung disease. If you notice any changes in the shape of your toes or nails, it's essential to consult with your doctor. They can determine the cause and recommend any necessary tests or treatments. Okay, let's be real. Nobody likes stinky feet. While foot odor is often attributed to sweaty shoes and poor hygiene, it can sometimes be a sign of something more serious, like a bacterial or fungal infection. If you experience excessive foot odor that doesn't improve with regular washing and antiperspirants, it's worth talking to your doctor. They can determine the underlying cause and recommend appropriate treatment options. Thanks for watching. If you found this video helpful, give it a thumbs up and share it with your friends. Remember, our feet work hard for us every day, so it's important to pay attention to what they're trying to tell us about our overall health. And hey, speaking of health, stay tuned for our next video where we'll discuss how a blood-type diet can help reverse these health issues. We'll dive deep into the science behind it and how it can be tailored to your specific needs. See you next time, and take care of your health. Care of your